Yes.
What's the most common way that companies clean gloves before they're boxed? Do they use like gamma radiation or?
Some use ethylene oxide, some use gamma ray. I think as someone who's never rep nor worked for a medical supplies company, I don't know that I feel super qualified to answer that question as far
I'm
as
just
what most
wondering the
companies do.
cleanliness of a glove.
Uh-huh.
You know what I mean? If you've got a clean setup and you're not working out of a statum, so you're using your gloves from a box to do, piercing, and you're keeping your equipment or whatever on the inside of your package for a sterile field, and then you switch your gloves and go do your piercing.
Right.
How clean are the gloves that you're basically touching all your equipment with to do the piercing?
That's a great question, and I would say you would need to check with the manufacturer of any particular brand to see how they're sterilizing it, but I can tell you that they're clean enough that over 40,000 piercings, almost all of them done with non-sterile gloves, have not apparently been causing infections to people. So, that's kind of it's not a very scientific answer.
I'm kind of curious about, 'cause I mean, I've worked out of like a statum before and
Yeah.
things like that, and I honestly feel like statuming gloves thins them out or just kind of decreases their integrity.
Yeah, manufacturers don't necessarily recommend that. I'm not sure if anybody's familiar with is it chloroprene? Is that what the new ones are called? The non-nitrile ones?
Chloroprene.
And are you finding, do you know if those are more autoclavable?
I don't know. I know that they're actually autoclavable. I don't know if you
Yeah.
can do it in-house or not.
I did in my last studio that I guest pierced at in Long Beach. I was using, West Hollywood, was using those in a statum, and I love them. So if you use a statum regularly and would like to autoclave your own gloves with your setup, that would be a great way to do it. They're much easier to put on than the nitrile gloves, which are hell, and they have more stretch and give to them, much more like latex, and they're autoclavable. So they're a great new product as far as I know. Also, there is a part in my book where it discusses that the medical exam gloves, the non-sterile box version like we're talking about, are considered acceptable for venipuncture in phlebotomy. So, as piercers, we can draw to some extent from what is in use in the medical community and see how that applies to our community. And certainly, if you're going directly into a vein or an artery with arterial blood gases, I believe they use the same gloves whether they're doing either procedure. So those are certainly things that if you're going right into the bloodstream, then a glove that's considered acceptably protective is important, and those are used in the medical community.